In his address to the nation on Friday, Prime Minister Modi appealed to the people to fight the coronavirus darkness by lighting lamps on 5th April at 9 pm for 9 minutes. He urged people to switch off the electric lights in their homes as part of the exercise, which is aimed at keeping spirits up as India remains under a 21-day lockdown to curb the spread of the COVID-19. India's positive COVID-19 cases soared to 2,301 on Friday with 235 fresh cases on a single day, and most of them linked to the Tablighi Jamaat event in Delhi in March. The death toll stands at 53. Meanwhile, the global coronavirus figures have topped 1 million as the pandemic spreads across the world. The World Bank has said that it has approved an initial $1.9 billion in emergency funds for coronavirus response operations in 25 developing countries, with more than half the aid earmarked for India. Sri Lanka, Pakistan, Ethiopia were also those that received shares of the funding. The financial assistance for India will be used in better screening for the virus, contact tracing and laboratory diagnostics, pay for personal protective equipment, and for setting up new isolation wards. The Delhi government has asked the police to provide extra security to hospitals and quarantine centers where hundreds of people have been evacuated from the religious center in the city's Nizamuddin area. The Delhi Health Secretary has written in a letter to the Delhi Police Commissioner that many of those evacuated from the markaz or headquarters of the Tablighi Jamaat are not cooperating with authorities. A study by the Indian Council of Medical Research suggests that while the 21-day lockdown will bring down the number of positive COVID-19 cases, the lockdown needs to be accompanied with aggressive testing and quarantine measures for the fight against the virus to be successful. The study says extending the lockdown will not help without additional interventions. The research team is now modeling the required intensity of a test and quarantine strategy, how quickly cases need to be identified, and how much quarantine compliance is needed in order to prevent a second epidemic. In a survey conducted by the Department of Administrative Reforms and Public Grievances, district collectors and district magistrates have said that there is an overwhelming shortage of key personal protective equipment and isolation beds at the district and village levels, and that the lockdown should be extended to prevent a burden on healthcare facilities. Another key action recommended by the responders was to test more people and find more positive cases.